My name is Jessica Garner. This is my speech video for Communications 101. This is my first listener, my grandmother Laura. This is my grandfather Don Sr.
Hi.
This is my mother Betty.
Hi.
And my uncle Don Jr.
Hey.
Okay, I'm going to give this to Betty here. Okay, so hello, my name is Jessica. I'm going to start the speech out with a question. How many of you know someone, it's yourself included, that has any form of arthritis? Can you raise your hand? Okay, thank you. And how many of you know someone who has arthritis in the spine? Okay, good. Thank you for that, and thank you so much for coming. My name is Jessica. I'm 6 years old, and I also have arthritis in the spine. It is a form that is less common than osteo or rheumatoid arthritis. It is called Ankylosing Spondylitis. I'm going to call it AS for short throughout the speech here. This form of arthritis is the most unrecognized form because the specific symptom, the main symptom, is general back pain, which how many people here have not had back pain at some point in their life? Pretty much everybody has had back pain. So you can see why it would go unrecognized for so long. In reality, 500,000 people in the United States have ankylosing spondylitis. By the time I am done speaking, you will have much more information on this disease and hopefully an understanding of the effect that it can have on a person's life. AS can alter a person's life dramatically. Due to my own diagnosis and experience, took it upon myself to do a lot of research on the subject. I have read countless reports, articles, and research results from credible medical websites. First, I would like to discuss the background of AS as well as diagnosis and treatment options. Secondly, I will talk about the effect AS can have on a person's life and their working conditions. Third, I will breach the topic of age and gender in people with AS. And finally, I will share my own experience that I've been dealing with due to AS. First of all, what is ankylosing spondylitis? The Spondylitis Association of America identifies ankylosing spondylitis as part of a group of chronic diseases consisting of inflammation in the vertebra. Ankylosis means joint fusion in the vertebra from inflammation, forming scar tissue that will calcify. Calcify meaning it will become a bone. And then these bones join together. I mentioned earlier that 500,000 people in the United States are diagnosed with AS. The Centers for Disease Control estimates there are 2.7 million adults that have AS, some form of spondyloarthritis. AS specifically affects the spine and oftentimes related to joints like the hips is involved. Inflammation in the spine causes chronic pain and discomfort with the possibility of leading to bone fusions that cause a hunched over posture and immobility. Pain and stiffness from the inflammation is common and can prohibit basic activities like walking with ease. The most known contributing factor to developing AS is in genetics. There are around 5 or 6 genes involved in being susceptible to AS. The most common gene is actually a protein called HLA-B27 that primarily causes chronic inflammation. Blood tests can detect this gene and help with the diagnosis. Other steps for a diagnosis are usually done by a rheumatologist, which is a physician who specializes in inflammation disorders or other problems involving the joints, the bones, muscles, ligaments, and tendons. Physical exams, x-rays, and a family history can help a rheumatologist with your diagnosis. There is no cure for ankylosing spondylitis, or any form of arthritis for that matter. Different treatments work for different people, and their symptoms. Not everyone is the same. Everybody is different. Things work for people differently. Common treatments include medication, certain exercises, physical therapy, rehabilitation, and heat and ice therapy. For severe cases, surgery for joint replacement may be necessary. Many people look to alternative treatments that are considered non-traditional. They include acupuncture, chiropractic adjustments, massage, yoga, and oriental medicine. These treatments have helped some people with their ankylosing spondylitis symptoms and also helped improve their quality of life. Treatments are lifelong, however. In the process of trying to find which treatments work for an individual, AS may affect a person's life negatively, calling for some adjustments. According to a research study by the UK Scandinavian Journal of Rheumatology, 44% of the 612 patients with AS that participated in this study were in fact unemployed because of complications from their disease. Their illness compromised their physical, social, psychosocial, and financial well-being. Depression was found to be common and highly associated with their unemployment. The study also found that 25% of people with AS had to change jobs or careers because of their disease-related limitations. The BMC of Musculoskeletal Disorders conducted a survey called The Information Needs of People Living with Ankylosing Spondylitis in 2012. The survey took a specific look at age and AS. According to the survey, ankylosing spondylitis usually occurs in your 30s, and it affects 2.5 times more men than women. The age of the first noticed symptoms is around 25, with their first diagnosis being in their early 30s. So that's about 10 years of when their symptoms start to when they get diagnosed. Only 10% of people with AS are 20 to 39 years old. 36% of people are 40 to 59, and 54% of the people with AS are 60 years or older. While this does mostly affect people later in life, this is a disease that is being recognized in younger generations as well. The last part of ankylosing spondylitis that I would like to discuss is the most personal to me, which is my own experience. The first symptom I had was when I was 17 years old. I woke up one day and could not move my entire lower left side, starting from my hip all the way down. The pain was intense, but it only lasted for a week, so I figured I pulled a muscle or something to that effect. It would be 4 more years until this came about again. I fell asleep one night perfectly fine and woke up the next day unable to move, again my whole left side. This time the pain was absolutely debilitating. For 8 months, simple tasks such as turning over in bed or walking to the bathroom became long and painful processes. I was always home and always resting. My social and active life went down. A feeling of depression hovered over me. My primary care doctor told me many times to just go home, rest, stretch, ice, and take ibuprofen, which did not budge my pain at all. I felt hopeless, and there were times where I would wake up in the morning and without even opening my eyes, I would start to cry because I was so depressed from the pain that I was going through. Relationships were affected greatly. I felt that people would judge me due to their own lack of understanding of the realness and severity of my pain. In a way, I almost felt guilty for my own illness. I would wonder why this would happen to me and if I would get better and be able to do something with my life, or if I was just in fact crazy. After 8 months of nonstop pain and doctor's visits, I was sent to a rheumatologist who ordered an x-ray that showed inflammation in my lower back joints. From there, he ordered a blood test, which did determine that I do have one of the genes that is found in AS, which is HLA-B27. And he diagnosed me with ankylosing spondylitis. I got on specific medication. I also went and saw a physical therapist, both of which helped me greatly for a while. Occasionally I do still get flare-ups. Sometimes they last a couple days, sometimes they last a couple weeks, sometimes they last months. Most recently, I have been seeing a chiropractor and doing restorative yoga for my back, which I've discovered has helped me greatly, also with adjusting some medications. There have been some silver linings since I have been dealing with AS. You find a strength that you never knew you had through yourself and through the people around you. In disability, it's no question that you definitely find out who your real friends and family are. All of a sudden, little things like being able to walk your dog or going and sitting lunch with your family become a big deal to you. Superficial things are considered silly and they no longer matter. The big picture of what life really is, which is a series of ups and downs, is suddenly right before your eyes. And the only way to get through those downs is to hold on to the people that are still around, learn from it, and let it make you a better person. Ankylosing spondylitis is an autoimmune disease that causes chronic inflammation in the spine. It affects both younger and older people and can prevent a person from doing their basic life necessity activities and from the activities they enjoy. Working and personal relationships can be affected. The pain and frustration from the years of going undiagnosed and ineffective treatments can alter a person's mood and behavior dramatically. AS is mostly thought of a genetic susceptibility with possible environmental influences. It is more common in men than women. However, the numbers of women and juveniles with AS are increasing. It is without a doubt that the physical pain and emotional roller coaster I have gone through with AS has been one of the most consistent frustrations I have had to endure. The best thing AS has done for me is given me an unforgettable lifelong lesson of personal strength and a restoration of hope for a better tomorrow. And that is it. Thank you.
Very good.
Thank you.
Very good.